Welcome to a deep dive into the future of thoracic medicine.
The future.
Yeah. And get this, we're exploring tech that can monitor your health without you wearing a single sensor.
Wow.
No smartwatches, no chest straps, nothing.
Wild.
And leading the charge in this field is Dr. Wentelu.
Oh, Dr. Liu. He's doing some truly groundbreaking work.
I've heard.
He is an adjunct professor at Taipei Medical University and chief physician at Shuanghe Hospital's thoracic department.
Wow, impressive.
Between 2021 and 2025 alone, he's secured 17 patents.
17 patents.
It's almost one every few months.
In just 4 years. That's incredible. Talk about a prolific innovator. I'm already intrigued. What are some of the areas where Dr. Liu's work is making the biggest waves?
Well, one area that really stands out is sleep quality.
Sleep quality?
Yeah, we all know how important sleep is.
Oh, definitely.
But Dr. Liu's research reveals a fascinating connection between sleep quality and memory consolidation.
Oh, what?
It's not just about waking up feeling refreshed.
Hmm.
It's about how well your brain processes and stores information while you sleep.
So better sleep actually leads to better memory.
Exactly.
That's huge.
Yeah.
I always knew pulling all-nighters wasn't doing me any favors.
Exactly. And what's exciting is that Dr. Liu isn't just studying this phenomenon. He's actually developing technology around it.
Okay, cool.
Yeah, he's patented a household sleeping monitor
Wow.
and a sleep quality assessment system that could seamlessly integrate into your home.
Oh.
Imagine getting personalized insights into your sleep quality without having to wear any uncomfortable devices to bed.
No more bulky sleep trackers or worrying about charging them. Sign me up.
Exactly.
But how does this technology actually work? Can you tell us more about the science behind it?
Well, Dr. Liu is exploring some really innovative approaches. One of them involves sound analysis.
Oh, okay.
He's discovered that subtle changes in breathing sounds and even vocal patterns before and after sleep can indicate sleep apnea.
Hold on, analyzing my voice to detect sleep apnea. That sounds almost too good to be true.
It might sound surprising, but the technology is very real.
Really?
Yeah, and it goes beyond sound analysis. Dr. Liu is also using millimeter wave radar,
Oh.
which might sound like something out of a sci-fi movie.
Yeah, it does.
But it's actually a very effective way to monitor breathing patterns with incredible precision.
So it's like having an invisible radar system in your bedroom tracking your every breath while you sleep?
Yeah.
That's mind-blowing.
It is pretty amazing.
This is making me think about the whole concept of a smart home in a completely new light. If my house could monitor my health while I sleep, that would be amazing.
You're right, it really opens up exciting possibilities for how technology can be seamlessly integrated into our lives.
Seamlessly integrated. I like that.
And speaking of seamless integration, Dr. Liu's work also extends to optimizing CPAP therapy, a common treatment for sleep apnea.
I've heard about CPAP machines, but to be honest, I don't know much about them. Can you give me a quick rundown of how they work?
Certainly, CPAP stands for Continuous Positive Airway Pressure. It involves wearing a mask that delivers a constant stream of air to keep your airways open during sleep.
Okay.
While effective, some people find it uncomfortable or disruptive.
I can see how having to wear a mask all night could take some getting used to. So how is Dr. Liu improving this experience?
His research focuses on using ECC patterns to predict apnea events before they even happen.
Wow.
By analyzing your heart's electrical activity, the CPAP machine can anticipate when an apnea event is likely to occur and adjust the air pressure accordingly.
That's amazing. It's like the CPAP machine can read your body's signals and adjust itself in real time. That would definitely make the therapy more comfortable and less jarring.
Exactly. It's all about making the therapy more personalized and effective. But it goes even deeper than that. Dr. Liu is also using heart rate variability data,
Okay.
not just for physical health insights, but also to assess mental states.
Wait, really? My smartwatch tracks heart rate variability, but I always thought that was just about stress and recovery. How can it tell you about someone's mental state?
It's all about analyzing those tiny fluctuations in your heart rate and how they relate to different emotions and cognitive processes. Think of it as a much more nuanced version of a lie detector test, but instead of focusing on deception, it's providing insights into your overall mental well-being.
Wow, that's incredible. So just by analyzing heart rate variability, we could potentially gain a deeper understanding of someone's emotional state. What are the implications of that kind of technology?
The possibilities are truly vast.
Vast.
It could revolutionize stress management techniques, help therapists tailor their approaches, and even shed light on how we react to different people and situations.
It's like opening up a whole new window into the human mind. It makes you wonder what other secrets our bodies are holding that we haven't even discovered yet.
You're absolutely right. And Dr. Liu's work is a testament to the fact that we're only just beginning to scratch the surface of what's possible. But his exploration of non-wearable tech doesn't stop there. He's also using it to unlock insights into cardiac function.
Okay, now we're talking heart health. I'm curious,
Now,
how does non-wearable tech play a role in that?
one way is through the analysis of periodic breathing.
Periodic breathing.
It's an irregular breathing pattern that can be a sign of underlying heart problems. By monitoring your breathing patterns, we could potentially glean valuable information about your heart's health.
So it's like our breathing patterns are sending out subtle clues about what's going on with our heart. That's fascinating.
It is, and Dr. Liu has developed a method for measuring lung-to-finger circulation time,
Lung to finger circulation time.
using something you probably have in your pocket right now.
Okay.
A simple G sensor, the same technology in your phone that rotates the screen.
It's amazing how something as simple as a G sensor can be used in such an innovative way to reveal so much about the heart.
Exactly. It just goes to show that innovation doesn't always require complex technology. Sometimes it's about finding new and creative ways to use the tools we already have. But Dr. Liu's work extends beyond simple sensors. He's also exploring how non-wearable tech can be applied to more complex medical procedures like hemodialysis.
Hemodialysis, now that's a medical procedure I don't know much about. Can you fill me in on what it is and how non-wearable technology comes into play?
Of course, hemodialysis is a life-saving treatment for people with kidney failure. Essentially, it involves using a machine to filter their blood, removing waste products and excess fluid that their kidneys can no longer handle.
That sounds like a pretty intense procedure. How does non-wearable tech improve that process?
Well, Dr. Liu's research is looking at how to use non-wearable technology to monitor patients during hemodialysis. Imagine a system that could provide early warnings for hypotension, which is dangerously low blood pressure, a common complication during the procedure.
That would be a game changer for patient safety. What else can this technology do?
It can even detect muscle cramps,
Oh, wow.
which are another common and very painful issue for hemodialysis. Imagine a system that could alert medical professionals to these cramps in real time, allowing for faster intervention and relief.
This is incredible. It sounds like this technology could really make a difference in the lives of people undergoing hemodialysis, improving both their safety and comfort during treatment.
That's exactly what Dr. Liu is aiming for, but his vision doesn't stop there. He's also exploring something called non-invasive fiber optic physiological monitoring technology,
Non-invasive fiber optic physiological monitoring technology.
or NFOPT for short.
NFOPT, okay.
It involves using fiber optic sensors to gather even more precise data about heart rate and breathing.
Interesting.
It's still in its early stages, but imagine a future where these sensors are embedded in everyday objects, providing continuous monitoring without you even realizing it.
That's mind-blowing. We're talking about a future where our homes and even our furniture could be helping us stay healthy. What are some of the specific applications Dr. Liu is exploring with NFOPT?
One exciting application is in CPAP therapy. This technology could lead to the development of optimal algorithms for CPAP adherence, essentially creating a CPAP machine that adjusts itself perfectly based on your unique breathing patterns throughout the night.
That would be revolutionary. No more uncomfortable masks or disruptive pressure changes, just seamless and personalized therapy. It's amazing to think how far we've come in just a few years. What else is Dr. Liu working on?
Well, he's also using NFOPT to explore what happens in our brains during deep sleep. His research suggests that our breathing becomes incredibly regular during slow-wave sleep, and this regularity is detectable by both radar and NFOPT. This could be key to unlocking a deeper understanding of brain activity during this crucial sleep stage.
Wow, we're really diving deep into the mysteries of the brain. Now, this is also fascinating, and I'm eager to learn more about Dr. Liu's findings. But before we get into that, I think it's time for a quick break. We'll be back soon to delve deeper into the research behind these incredible technologies. Stay with us.
Sounds good. Welcome back. We've been exploring some incredible advancements in non-wearable technology for thoracic medicine. It's really amazing how much we can learn about our health just from analyzing things like breathing patterns and heart rate variability.
It really is remarkable. Before the break, you mentioned that Dr. Liu is also using an FOPT to explore what happens in our brains during deep sleep. Can you tell us more about that?
Of course, his research suggests that during slow-wave sleep, our breathing becomes incredibly regular, and this regularity is detectable by both radar and NFOPT. It's a fascinating finding because it opens up a whole new window into brain activity during this crucial sleep stage.
I'm trying to wrap my head around this. So, just by analyzing someone's breathing patterns during sleep, we can potentially gain insights into their brain activity.
That's the idea. It's still early days in this research, but the potential is enormous. Think about if we can better understand what's happening in the brain during deep sleep. We might be able to develop new ways to diagnose and treat sleep disorders or even enhance cognitive function.
That would be incredible. It's like we're on the cusp of a whole new era in sleep science. Well, what else has Dr. Liu discovered about the connection between breathing and brain activity?
He's been studying something called respiratory sinus arrhythmia, or RSA for short. It's a natural variation in heart rate that occurs in sync with breathing. You're experiencing it right now.
Wow, so my heart rate is actually changing slightly with every breath I take. I had no idea what's so significant about this RSA phenomenon.
Well, Dr. Liu is particularly interested in how RSA coupling during sleep relates to different psychological states. Think about it. Anxiety, agitation, restlessness. These mental states can all influence our RSA patterns during sleep.
So by analyzing RSA patterns, we could potentially gain insights into someone's mental well-being while they sleep.
Exactly. It's like having a window into the subconscious. Imagine the possibilities for improving mental health care. We could develop personalized interventions, track the effectiveness of treatments, and even identify individuals at risk for certain mental health conditions, all through non-invasive monitoring.
This is truly groundbreaking stuff. It makes you wonder, what other applications could this technology have in the future?
Dr. Liu envisions a future where fiber optic sensors are embedded in everyday objects like mats to track breathing and balance throughout the day.
So not just monitoring our health while we sleep, but throughout our daily lives as well. What are the potential benefits of that kind of continuous monitoring?
It could be revolutionary, especially for fall prevention in the elderly. Imagine a mat that could detect subtle changes in balance and alert caregivers if someone is at risk of falling. It could also be used to monitor chronic conditions like COPD or heart failure, providing valuable data to healthcare providers and allowing for early intervention.
It's amazing to think how seamlessly this technology could be integrated into our lives. We could be gathering valuable health data without even thinking about it. But I have to ask, what about the privacy implications of all this monitoring?
That's a great question and an important consideration as this technology evolves. Dr. Liu is very mindful of these concerns and believes that privacy and security should be top priorities.
I'm glad to hear that. It's reassuring to know that researchers are thinking about these ethical considerations alongside the potential benefits.
Absolutely responsible innovation is key. But let's shift gears for a moment and talk about some of Dr. Liu's specific research findings that support these incredible claims.
I'm all ears. I'm eager to learn more about the science behind all of this.
One study published in the Journal of Clinical Sleep Medicine in 2024 focused on using millimeter wave radar to assess sleep quality. They found that radar could accurately distinguish between different sleep stages and even identify sleep apnea events with remarkable precision.
That's incredible. So just by using radar, they could gather detailed information about someone's sleep without any sensors on their body.
Precisely, and it gets even more fascinating in 2025. Dr. Liu and his team published a paper in the Journal of Multidisciplinary Healthcare that explored how heart rate variability patterns measured non-invasively could be used to assess anxiety, agitation, and restlessness during sleep.
So they were able to link specific heart rate variability patterns to those different emotional states.
But yes, they found distinct patterns that correlated with these psychological states, which is a huge step forward in understanding the mind-body connection.
It's amazing to think that something as simple as our heart rate can reveal so much about what's going on inside our minds. What about Dr. Liu's work on optimizing CPAP therapy? Are there studies that support the idea of using ECG patterns to predict apnea events?
Absolutely. In 2023, they published a paper in the Journal of Sleep Research outlining a prediction and regulation system and method for abnormal respiratory events in sleep duration and respirator device.
That sounds pretty technical. Can you break it down for me?
Sure. This study showcased their work on using continuous wavelet transform, or CWT, to analyze heart rate patterns and predict apnea events before they happen. This allows the CPAP machine to adjust the air pressure in anticipation of an event, making the therapy much more comfortable for the patient.
So the CPAP machine is essentially adapting to the patient's needs in real time. That's amazing. It sounds like science fiction, but it's actually happening right now.
It really is remarkable, and Dr. Liu's innovations extend to cardiac care as well. He and his team have been conducting a pilot study using wireless radar and deep learning in a cardiology setting. They're exploring the relationship between abnormal respiratory patterns and cardiac impairment.
So they're looking for clues in our breathing that might indicate heart problems. What have they found so far?
Their preliminary findings are quite insightful. They've discovered correlations between specific radar-based breathing parameters and cardiac conditions. For example, they found that as the respiratory disturbance index, or RDI, increased the left ventricular ejection fraction, a measure of the heart's pumping ability decreased.
So by analyzing breathing patterns, they can potentially identify individuals at risk for heart problems.
Exactly. They've also found associations between the length of periodic breathing cycles and biomarkers for heart failure. This kind of information could be incredibly valuable for early detection and monitoring of heart conditions.
This is all incredibly fascinating, but before we get too carried away with the science, I want to bring it back to you, the listener. Imagine a world where you can get a detailed picture of your health without wearing any devices. Think about the possibilities. Earlier, we talked about Dr. Liu's work with heart rate variability and how it can provide insights into our mental and emotional states.
Yes, that's one of the most exciting areas of this research. It's like having a new lens through which we can understand ourselves better.
It really is, and it's not just about individual health. This technology has the potential to transform healthcare systems as a whole. Imagine hospitals that can monitor patients remotely, reducing the need for lengthy and costly hospital stays.
It's about creating a healthcare system that's more efficient, effective, and accessible to everyone.
Exactly, and it's a future that's closer than we might think. Dr. Liu's work is a testament to the rapid pace of innovation in this field.
It is, and it raises so many important questions about the future of healthcare and our relationship with technology.
Well said. Now, before we wrap up this deep dive, there's one more aspect of Dr. Liu's work that I find particularly intriguing, and that's his research on interpersonal interaction.
Ah, yes, this is where things get really interesting. He's exploring how non-wearable tech can provide insights into the dynamics between people.
So far, we've talked about sleep, heart health, even hemodialysis. But how does non-wearable tech factor into our interactions with others?
Well, one of his patents is for an interpersonal interaction state analysis suggestion system. It's about using physiological data to understand how people respond to each other emotionally and cognitively during conversations or interactions.
Hold on, this technology can actually tell us how we're feeling during a conversation, even if we're trying to hide it.
It's not quite mind reading, but it's getting close by analyzing subtle changes in heart rate, breathing patterns, and even micro-expressions. This technology can provide insights into our subconscious responses to others.
That's incredible. What are the potential applications of this kind of technology?
The possibilities are vast. It could revolutionize couples therapy, provide more effective conflict resolution strategies in workplaces, and even help us understand how to communicate more effectively with our loved ones.
It's like having a real-time emotional translator during our interactions with others. It could be incredibly helpful in so many situations. This is mind-blowing stuff. But before we delve even deeper, let's take a moment to reflect on what we've learned so far. We'll be back shortly to continue our exploration of this fascinating technology and its potential impact on the future of healthcare. We're back and, ready to continue our deep dive into this groundbreaking world of non-wearable tech in thoracic medicine.
Thoracic medicine. It's a big field.
Yeah, before the break, we were discussing Dr. Liu's research on interpersonal interaction and, how it could potentially change the way we understand and navigate our relationships.
It's really fascinating, isn't it?
Yeah.
Imagine a world where we could gain a deeper understanding of not only our own emotions, but also the emotions of those around us during conversations and interactions. It could really revolutionize the way we communicate and connect with each other.
It's like having access to a secret emotional language that reveals what's really going on beneath the surface. But let's shift gears for a moment and talk about the research behind these incredible claims. You mentioned Dr. Liu's work with millimeter wave radar for sleep assessment. Can you remind us what they found in that study?
Certainly, one of Dr. Liu's studies published in the Journal of Clinical Sleep Medicine in 2024 focused on using millimeter wave radar to assess sleep quality, and they found that this technology could accurately distinguish between different sleep stages and identify sleep apnea events with remarkable precision.
Really?
All without any sensors on the body.
That's incredible. It really highlights the potential of this technology to make sleep studies more accessible and less intrusive. What about Dr. Liu's work on heart rate variability and its connection to mental states? Are there any studies that support those findings?
Yes, there are. In 2025, Dr. Liu and his team published a paper in the Journal of Multidisciplinary Healthcare that explored how heart rate variability patterns measured non-invasively could be used to assess anxiety, agitation, and restlessness during sleep.
So they found a direct link between these subtle heart rate changes and our emotional state. That's a game changer for understanding mental health.
Absolutely. This research opens up new possibilities for personalized interventions and earlier detection of potential mental health concerns.
It's remarkable to think that something as simple as our heartbeat can reveal so much about our inner world. What about Dr. Liu's work on optimizing CPAP therapy? Are there any studies that demonstrate the effectiveness of using ECG patterns to predict apnea events?
Yes, in fact, there's a study from 2023 published in the Journal of Sleep Research that showcases Dr. Liu's work on this very topic. They developed a system that uses a mathematical tool called Continuous Wavelet Transform, or CWT,
CWT.
to analyze heart rate patterns and predict apnea events before they happen.
So this CWT technology can actually anticipate when an apnea event is likely to occur.
That's right. It allows the CPAP machine to adjust the air pressure proactively, making the therapy much more comfortable and less disruptive for the patient.
It's like having a CPAP machine that can read your body's signals and respond in real time. That's incredible. Now, let's talk about Dr. Liu's research on cardiac function. Are there any studies that support the idea that non-wearable tech can provide insights into heart health?
There are indeed. Dr. Liu and his team have been conducting a pilot study using wireless radar and deep learning in a cardiology setting. They're specifically exploring the relationship between abnormal respiratory patterns and cardiac impairment.
So they're looking for connections between breathing irregularities and potential heart problems. What have they discovered so far?
Their preliminary findings are quite promising. They've discovered correlations between specific radar-based breathing parameters and various cardiac conditions, for example. They found that as the respiratory disturbance index, or RDI, increased, the left ventricular ejection fraction, which measures the heart's pumping ability, decreased.
That suggests that by analyzing breathing patterns, we could potentially identify individuals at risk for heart problems before they even experience symptoms.
Exactly. Early detection is key in managing heart conditions, and this technology has the potential to revolutionize the way we approach cardiac care.
This has been an incredible journey into the world of non-wearable technology and its potential to transform thoracic medicine. Dr. Liu's work is truly groundbreaking, and it gives us a glimpse into a future where healthcare is more personalized, proactive, and seamlessly integrated into our lives.
I think you're right. It's a really exciting time to be in this field. The possibilities are endless,
Endless.
and we're only just beginning to scratch the surface of what's possible.
Well, to our listener, thank you for joining us on this deep dive. We hope you found it as fascinating and insightful as we did. Remember, the future of healthcare is in your hands. Stay curious, keep exploring, and always ask questions. This is The Deep Dive, signing off.